This is my fight song. Take back my life song. Prove I'm alright song.
Just arrived at the surgery center. Let me show you guys. Right there is the surgery center. I'm freaking out. My throat feels like sandpaper and I really have to pee. Okay, wish me luck.
Cause I've still got a lot of fight left in me. My voice this time, this is my fight song.
I just got out of surgery. I'm surrounded by a bunch of pillows here. Because my boob is up against this door, and so I wanted a lot of stuff. Yeah. Anybody that's had a surgery, I don't know how long it's going to be till you guys see this, but I taste rubber, like the oxygen mask thing. I still taste it, and I got out like 20 minutes ago. But is there anything that can help with that? Because it's disgusting. Oh, I'm going to go back to sleep, so I'll update you guys. We're driving home right now, so. Oh Lord, I look like crap. Alright, bye guys.
In motion, like how a single word can make a heart open.
Hi everyone. If you're new here, welcome to my channel. If you're already a subscriber, welcome back to my channel. So today I'm going to be doing my update video on my breast cancer surgery. They called it a retroareolar excision biopsy. I forgot to mention my name's Jennifer. And if you've been subscribed to me, you've probably seen my previous videos on everything that's been going on. So I'm sorry it's taken a while to get this uploaded. It's just I've been in a lot of pain since my surgery, and then I've been trying to explain everything. It's like my case is a really complex case, so I've been trying to explain everything as much as in as much detail as I can to my family and friends and stuff. So sorry if you hear my cat in the background. She's playing right now. So alright, well I'll start from the beginning. So like 3 or 4 months ago, I think it was in November, I found a lump in my breast, my right breast. And ever since I was, let me explain my headscarf here. It's really hard to hold up my hand for very long, my arm on my right side, because the arm muscles are connected to the breast muscles, and it was from the outside of the nipple clear out to the outside, kind of underneath my arm is where they took the mass from. So my hair is unruly, so I just threw the headscarf on. I was going to put a ball cap on, but it would have blocked like the light in my face, so wouldn't have seen me very well. Anyway, back to the story. Yeah, 3 or 4 months ago, I think it was November, I was doing my own self-breast exam, which I was taught way back when I was in high school. There goes my cat again. And I felt a small lump. It was probably about that big, like the size of a small grape. And so I immediately, I knew from years of doing my own exams that that was not normal. I have pretty normal breasts. They're not lumpy or anything, lumpy bumpy kind of thing. So that wasn't normal for me. So I immediately called my primary doctor and said, hey, I need to make an appointment. And she suggested that I see, she's like an OBGYN, sorry about that, OBGYN women's health doctor. So I called her up and I said, hey, I found this lump and it's not normal and I need to make an appointment. So I set that up with her and I went and saw her and told her what was going on. I had a little bit of kind of clear but slightly bloody nipple discharge. Sorry if this is TMI, guys. So if you're squeamish or, you know, underage or can't handle any of the TMI stuff, then just click off the video. I guess I should have said that sooner, but there's so much stuff that I want to go over in this video, and I didn't write anything down. I do have my medical records, some of my medical records right now, and then some stuff I wrote down. So I went in and saw her, and she did the exam, and with some other stuff that was going on, she was immediately super worried about it because where it was at, you know, so I don't have health insurance. And so she has a place that she goes through that helps people pay for stuff like this. So I think I had to wait a couple weeks for she scheduled me a mammogram and an ultrasound. No, just the mammogram and then possible ultrasound. And so, sorry guys, my brain's just all over the place with everything that's been going on and it's happening so fast. But, so it was a couple weeks before, between my appointment with her and then my mammogram and ultrasound. So I waited the couple weeks, and over those couple weeks I kept feeling my lump and it was growing super, super fast. And that scared me. All the while I was doing research on what could it be, you know, and what each type of thing that can happen in your breast, how fast they grow, where they're at, what they feel like. Normal breast lumps or masses, they move and they're like perfectly round. Mine was long and oval, but it was bumpy and it did not move. So anyway, back to the appointments. I went to my mammogram and got that done. They put like a little marker where on the outside of my breast where the lump was underneath. Well, at this time it was a mass. It was really big at this point. And so they did the mammogram, and that's when I found out I have really dense breasts, which greatly increases your risk of breast cancer. Sorry. I know that doctors informing women of their breast density is a new thing because I don't know what year. I guess I should have wrote it down. But for a long time, they weren't telling women, and which is bad because dense breasts can affect your breast cancer risk. It makes it really high. So they told me I have really dense breasts, and they couldn't see the lump or the mass on the mammogram because of that. So they said, well, she recommended a possible ultrasound, so we're going to go ahead and do that. And so I went straight from the radiology room or mammogram room, and the ultrasound room was right next to it. So I just walked over into there, didn't have to get out of my gown or anything. I took my mom with me to these, and I was so happy to have her there with me because, like, you don't know what they're going to tell you. And it was my first mammogram ever. I just turned 41 in December, so they lay me down and put this really cold gel on my breast and and get to the mammogram, and they still didn't see the mass. So they told me they were going to send all this stuff over to my doctor, not my primary, but the women's health doctor. And so they did that, and I went home, and she called me and she said, well, now it's really worrying me because with dense breasts, it's really hard to see cancers on the mammogram and ultrasound. And like I said, her office was, sorry about that, my cat. Her office was paying for all this stuff for me. Kitty. And so she said, well, I went and made another appointment with her, and she felt it, and it had like over tripled in size at that point. And she said, and the nipple discharge was coming out a lot more. So she said, I'm going to get you in to see a surgeon, breast cancer surgeon. and I had to wait like a month or two for that because of the payment issues. And they wouldn't pay for it, so I had to save up for it also. And so, Shirley, sorry about that, guys. Come here. Yeah. Where was I? Oh, my surgery. Yeah, she was really worried about it. Just because they couldn't see it on the mammogram and ultrasound, and but everybody could feel it. It was there, and it was way bigger than when I first found it and when my first appointment with her. Like, it way over tripled in size. Sorry, I wasn't sure how to word that. So I called the surgeon when I came up with the money and made an appointment for that. And then he brought me in to see him before the surgery. I think it was like a month before my surgery. I had a pre-op with him, and he felt it, and he said, we definitely need to get in there and biopsy it. He didn't want to do like a core needle biopsy or like an ultrasound guided core needle biopsy. He wanted to just take the whole thing out because of how fast it was growing. And he did note the discharge. It was still doing that. And it was really painful. Like, not, how do I describe it? Like a deep, not stabby, but burn pain. And it was like very interruptive with my life and stuff. So, like, I didn't get a lot of sleep a lot of nights. I mean, I didn't get enough sleep a lot of nights. So I did my appointment with him, and then I was just waiting for my surgery. 2 out of the 3 of my doctors were super worried about it, and the other one, my surgeon, was like, well, I think I know what it is, just because of how fast it's growing. Sorry guys, hang on a second. But I'm not going to say anything until we get in there and take it out and send it off to be biopsied. So surgery day comes along, and I'm really freaking out at this point. A little bit of it was because of the surgery itself, because I have really severe anxiety. But I think most of my worry and being scared was from getting the biopsy results back, because like 2 out of the 3 doctors were extremely worried about it. So surgery day comes around, and I'm getting everything ready. I had to get up super early. I think it was like 1:30 in the morning. The surgery center is about 45 minutes from my house. So the whole way there, like, I couldn't eat or drink anything from midnight the night before, so my throat was just, it felt like sandpaper. My stomach was growling really bad, and the roads were really bad because we were having a snowstorm blizzard type thing. So drinking coffee helps me calm down, and I couldn't do that. So we finally made it down there. They bring me in, and they did like a urine sample test to make sure I wasn't pregnant. I'm not sure why they didn't do that a few days before, but I did it when I got there. Checked me all in, had me change into like this little blue hat and my gown. I had to take everything off except I could leave my undies on. They gave me these little blue thin socks that match the cap. I'll insert a picture here. I don't have a picture of the socks, but I do have a picture of the gown and the cap. Laying in the I think it's the room they put you in before you go back to the surgery room, the operating room. So I get all dressed. They told me before my surgery to bring a sports bra or something that hooks in the front. You don't want to have underwire, because that'll really hurt. So I brought the best thing I could find, which was it was kind of like a sports bra, but a regular bra without underwire. So had that, put that in my bag. Came out of the bathroom, and the lady I had that was taking care of me while I was waiting for my surgery, she was amazing. I don't remember what her name was, but because I was just worried and freaking out, and my anxiety was through the roof. I did do a video on what I packed with me. Hold on a second, guys. Let me take a drink so I can clear my throat. I did do a video of the stuff I packed with me to bring to my surgery. And they told me to bring my Bluetooth headphones and my phone so I could watch videos or listen to music while I waited. So I got my surgery outfit on. I looked amazing. Fabulous. So they took me back to my little room. It was like a little room with a bed and a chair and all their medical stuff. And it had like a little curtain. It had walls on the side, but the front just had, oh, sorry. The front just had a curtain that you pull shut so people can't see into you. So I get back there and I get in the bed, and the bed is like super warm, which is not normal. Every hospital or emergency room or anything I've ever been in, the beds were super cold. I did have one of those little white, super thin blankets, but after a few minutes, the bed did get a little cold, so she handed me this, I call it like a hairdryer tube, and she put it under the blanket with me, and I warmed back up pretty fast. And also, when she was putting my IV in, she had me hold on to that hairdryer tube to warm up the veins in my hand. And so they put my IV in, and then I think I had to wait like an hour and a half. The whole time I was sitting there, I didn't charge my phone on the way down, so I had to turn it off. And then as I was sitting there, I was getting really worried because I didn't have anything to keep me occupied. And as some of you may know, I lost my dad this past August. And so I was sitting there worried about the surgery and what was going to happen, and worried about the biopsy results. And nobody was around my room at all. I could see the nurse's station desk thing from where I was. I could see it straight out in front of me. And everybody was over there talking with each other and stuff. And all of a sudden, my curtain opened like somebody was coming in, and then it closed back. And then I heard the chair, this little wooden chair next to my bed, start squeaking like someone was sitting down. And all of a sudden, I just got like this feeling of calmness rush over me. And I was like, my dad's here with me. He's gonna help me through this. So a little while later, they came in, and the surgeon talked to me, and he marked on my nipple where he was going to do the incision. He actually did it on the outside, which was right above my mass, and he did it about from the top all the way around to the bottom, which will leave hardly any scars. He didn't want to have scars elsewhere on my breast. So I talked with him, we did that, and then my anesthesiologist came in and was talking to me about what he was going to do, and allergies, and if I had any metal in my body, made sure all my jewelry was off. And then I had my nurse come in. He was a male nurse, and he actually brought this little denture cup in for me. Yeah, I wear a top denture. They told me I could wear it, but not to use any adhesive, so I didn't. But they did take it off for surgery. Sometimes they do, or they took it out for surgery. Sometimes they do, sometimes they don't. So he came in and put my teeth in a little cup and sat him with my stuff. And I was wearing a face mask, a face mask. So I did get to put that back on so nobody could see me without my teeth in. I really don't like how I look without my teeth in. So after that, I had to wait like another half hour, and they came back and started wheeling me back to the operating room. I got back there and it was super cold. It felt like a meat locker. And I actually told him that. I said, it feels like a meat locker in here. And then the anesthesiologist and nurse said, yeah, it's to keep our tempers cool. and I think he was making a joke, but it just went over my head because I was thinking about all this other stuff that was going on around me. They were trying to move me from my, I'm not sure what they call the room that I was in, but from that bed over to the surgery bed. And then I got on there, and then the anesthesiologist was back behind my head, and my nurse was down at the bottom putting on the compression legging things that they go like this to keep your blood flowing, I guess, when you're in surgery. And at that point, I was really starting to freak out and getting really scared. And so I could see the anesthesiologist behind me and the nurse at the foot of my bed, and all of a sudden, I felt a hand touch my face, and I knew it was my dad again. And then all of a sudden, I just got super calm. And then I heard the anesthesiologist say to me right after that, he says, I'm going to put some stuff in your IV, and you'll be going to sleep. Lights out here in 3, 2, 1. And then that's all I remember. I guess I was out. I fell asleep. So I wake up in the, I'm hoping I'm not forgetting anything. I'm trying to remember all this all at once. I woke up in the recovery room. All my stuff was there. They wouldn't let my husband come in with me, but I was in a lot of pain. I wasn't in there too long, maybe about half hour. They gave me some apple juice. I asked for some apple juice because I was super, super thirsty. But when I woke up, I was like shaking really bad and really, really cold. So they put the hairdryer tube back under the blanket with me. And then when they were getting me up to get dressed, I stood up on the floor and I was just wobbling like this. I was so dizzy. They said the surgery went really well. He actually got the mass, and let me get my folder here. I'm going to tell you the size of the mass. He got the mass and clean margins all the way around. Clear margins, sorry. Get my papers here. Where's the size? I know it says it in here somewhere. The mass was 4.7 centimeters from medial to lateral, 4.5 centimeters from superior to inferior, and 3.0 centimeters from anterior to posterior. So it was like really big. They said if it was 5 centimeters or bigger, they would have just sent me straight to chemotherapy. I don't know why they said that, but I didn't do any more research on that. So anyway, back to where I was. I was in the getting dressed and putting my bra on. I felt like I was going to throw up because of how bad it hurt. That's how bad it was. So they call my husband, and he pulls around to the front door, and they walk me out there and put me in, and we come home. And then the whole time at home, I'm in a lot of pain. They actually had to take half of my breast. So when I first saw it, it was just, I felt deformed, and I still feel the same way. It's still gone. It's not there. I feel, I don't know, it's just hard to describe. I don't feel like, and you know, I have a lot of respect and understanding now for women who have full mastectomies. Mine was just a partial mastectomy, or it's also called a retroareolar excision biopsy. But he sent the biopsy off immediately after that, which is what I was waiting for. And then a few days later, I got an email, and because I have a patient portal online, I can go to and see all my files and stuff on their website. And I was going over the biopsy, and so I was Googling the words of what it said, and I'll tell you what it says right now. Sorry, put that right in the way. Let me get my records here. I have some of the records, but we're still waiting on, I still have to get my mammogram and ultrasound ones. And they also didn't give me a BIRAD score on how dense my breasts are, so I need to find that out. I still have to make an appointment with my primary to do all that. There's a lot of stuff I still don't know yet, and that we still have to go over so far. So, but there was columnar cell change, and forgive me if I pronounce any of these wrong. Columnar cell change, patchy chronic inflammation, proliferative fibrocystic changes, including apocrine metaplasia, stromal fibrosis, duct ectasia, there's microcyst formations, and microcalcifications. And all total, formalin fixation time for the biopsy was 34 hours. So, and I think he said that's how long it takes him to go and put it under the microscope and basically go through everything. So, my surgery was my surgery was on February 21st. My post-op was March 1st. So, I'm just super worried about the biopsy because I can't understand anything in it. And Googling it, there was just so much stuff that it detailed. And my surgeon actually said that it was super complex. So, I didn't even know, like, I wrote down a bunch of questions to ask him, but he only kind of went over generally what it was. So, it's precancer. If we would have left it any longer, I would have been at, like, stage 1, but right now I'm considered stage 0. And so that means breast cancer will do the job for now. I mean, not breast cancer, surgery will do the job for the breast cancer right now, and then I won't need radiation therapy. I was trying to remember what that's called. I almost said radiology. Radiation therapy, I won't need that, and I won't need chemo right now. But with everything that's going on in there and what it is right now, which is precancer stage 0, it would have been cancer if I would have left it. And that means they want to, with the microcalcifications and the calcifications and, what's the other one I said? I'm glad I have these medical records. Yeah, the calcifications and stuff. And then the stromal fibrosis. So basically it was in my duct. He cut the duct out with the mass. And it was all contained in the mass. It was in situ, which means it didn't invade anything else. So that's why I'm stage 0. They're going to watch me super close for the next 6 months. Make sure nothing else is growing again, which I have a really super high risk. I think it's like 70% to 80%. On top of the high risk because of the dense breasts. So they're going to keep a close eye on me for the next 6 months. And in 6 months, he wants me to do another mammogram, but he also wants me to start doing MRIs. Because with my dense breasts, they couldn't see my calcifications. And that's why a lot of breast cancers go unmissed. They just go missed. They miss them. They can't see it. So it's good for you ladies and men even to know how dense your breasts are. So do your breast exams, get your mammograms, and ask them, because a lot of times the radiologist won't tell you what your breast density is. They did tell me mine were super dense, extremely dense actually, but they didn't tell me the BIRAD score or, BIRAD score. I think it goes through 1 through 4, or no, A through D. That's what it was. But I think I'm probably in between C and D or at D. Anyway, so right now I'm super high risk of the cancer coming back between now and 5 years. Not coming back, but, well, yeah, coming back, but, turning into, what's the word? What did he say? Invasive. That's the word he used. So 6 months from now, they're going to monitor me really close between now and 6 months for these next 6 months. And in 6 months, he wants me to do a mammogram and then probably an MRI so that we can see what those calcifications are doing, and see what else is going on in there. So I do have to make some more appointments, and I'm pretty sure I'll find out more as I go. But I pretty much kicked cancer's butt before it had a chance to hurt me. So my husband said I evicted it before it could even pay its first month's rent. I do feel lucky and blessed because a lot of women, they don't catch it in time, or, you know, they don't find it on the mammograms or ultrasounds because of dense breasts. So, and like I said, it just became a thing where they're telling women now, they're required to tell women their breast density, but a lot of them still won't. So ask them, and just I highly recommend, if you don't feel like something's right and something's off, ask for more tests, ask for second opinions, and I really, really strongly advise you to do your breast exams like once a month, because if I hadn't, I probably would be in a really bad situation right now. We wouldn't know about it, and it would get worse. Who knows how worse? And I am just so happy that we found it, and I don't have to do anything else as far as we know right now. Sorry, guys. Just because I've had the worst past year, this whole past year, and just adding that on top of it. So I'm happy that I kicked cancer's butt before it had a chance to attack me, really. So yeah. I'm trying to think of anything else I was gonna explain. I still have a lot of pain in my breast, and half of it's still gone. I didn't do a reconstructive surgery, just because I don't have health insurance, and my husband said that it doesn't bother him. He would rather have half my breast gone than me dying or going through hell with chemo and radiation and stuff. They might put me on tamoxifen, because I'm such high risk, and my case is so complex. What it does, it's kind of like a chemotherapy, but it helps keep the cancer at bay. It helps keep it from coming back. But I right now at this point I am super high risk, so they're going to keep an eye on me for 6 months. And in 6 months we're going to do a mammogram, and I'm going to push for an MRI just because of my breast density. And you have that right. If you find out you have dense breasts and they tell you, oh, we don't see anything on the mammogram or the ultrasound, just go home, you're fine, come back in another year for your next mammogram. But that is why a lot of women don't find their breast cancer till it's past stage 2, stage 3, stage 4. So if you have dense breasts, tell them you want an MRI or ultrasound. Even ultrasound, it's hard to see, but it's better than the mammogram. They do have better mammograms than they used to, but with dense breasts, the cancer is white, and dense breasts are white too. So, I mean, it blends together. You're not going to see it. Even the calcifications, they're white. Even if you have a big cluster of calcifications, they're still white, and they won't show up. And that's what happened with mine. So yeah, if you're going through your mammograms, and they ask them, if they have never told you what your breast density is, ask them, make them tell you, because they have to. And I'm hoping with the information I found out, I can help someone else, especially if you've already been doing mammograms and they've never told you what your breast density is. Ask them. And then if you do have dense breasts and you want to even do another, like an MRI, just to make sure, just tell them, hey, I want an MRI, please. But yeah, so when I find out more about what's going on with me and what the plan is going to be for the next 6 months, which I don't know yet, I have to see my primary and go over that with her. And I'm thinking I want them to send my case to the cancer center, because then I can have a care team that will go over that with me. And I know my primary would recommend that also, just because of how high risk I am of it coming back and probably being worse, which I don't want. But please, please, please do your breast exams. It can save your life. And let other ladies in your life, even men can get breast cancer too. Let them know. Do breast exams. One thing I did find out is my doctors told me that the women aren't usually the ones that find the breast lump. It's the men. Makes sense. But I was the one that found mine. But yeah, mine just grew way out of control. Like the cells were on steroids, pretty much. I'm gonna, if I missed anything, I'll put it down in the comments or in the description, but I think I got everything. And I'll post pictures in the video too of, well, what pictures I was able to get. But yeah, so when I know more, I will let you guys know more. And thank you for sticking by me and waiting patiently while I go through this. I've been trying to get videos up, but there's just so much going on. Hopefully things will calm down now and I can get back to doing the things I like to do and get more videos up. And I'm actually wanting to write some more songs. I have some ideas in my head of where I want to start and what I want to do, so hopefully I'll be getting those up soon. But yeah, if you guys have any requests for me for songs, let me know. If you have been through breast cancer or know someone who has been through breast cancer, I can use all the advice, help, anything I can get for my situation and even for, you know, other types. Yeah, don't forget to like this video and subscribe to my channel. And if you hit the little bell icon and click on all, you will be notified when I upload future videos. So, but I'm gonna go and try and relax, let myself heal, and thank you guys for your prayers and your comments, and I appreciate you guys. You guys are awesome. So I hope I explained everything clearly, and I mean, this is pretty much what I know right now. So I hope you guys have a wonderful day, and I hope it's sunny wherever you are, because it's not here and it's rainy and dull. So hopefully you guys got some sunshine, and hopefully sunshine's coming my way soon. I just put up another video by Patsy Cline, a cover video. So go check that out, and I will see you guys in the next video. Bye guys.